Your day of surgery has arrived. Welcome. First step, reception. This is the ward. After you've been admitted, this is where you will come and get changed and get ready for surgery. After you've been checked in and seen by our anaesthetic nurse, it's time for you to come to theatre.
As your anaesthetist, we will have already had a chat before you arrive here in theatre, and I would have had the opportunity to answer all of your questions and queries and reassure you of the process here in theatre.
Welcome to theatre. You finally made it. We've got a great team on for you today and we take great care of you. We'll look after you. I'll see you soon.
After your operation, there'll be plenty of post-op pain relief. There'll be the medications there that the nurses will just give you, and then there'll be additional painkillers there if you need them.
So after your procedure, you'll end up here in the recovery ward, where we'll check your vital signs and make sure you're comfortable before we take you back up to the ward so you can have some breakfast or lunch.
After your surgery, this is where I'll come and see you, see how you're going and answer any questions.
For our day procedure patients, this is where you will come after your surgery. This is the end of your hospital stay. Please know we will take really good care of you every step along the way.